First of all, I'd like to ask your permission to use this video for educational purposes.
Yes, absolutely.
Okay, now, first of all, yesterday, let's go to core of it. You got a big surgery.
Yes.
You got a 4-level fusion. I'm turning around here and showing what we got. This is a 4-level fusion, and we got 8 screws, and actually 10 screws, 4 spacers, 2 big rods, and this is how it looked like. And it's a lot of metal. Actually, you almost got a pound of metal in you.
Oh, so I gained a pound too.
Yeah, you gained a pound, but you actually gained as well 1 to 1.5 inch of height.
Well, that's good. I can intimidate Candy better.
Yeah, you see, you have a sense of humor and you are smiling. I have been doing this for 20 years or more.
Yeah.
People after traditional surgery, they don't feel like smiling. They don't feel like
That's
joking.
why I waited for you.
Oh, thank you. But you weren't like this today. Tell me about yesterday. How was yesterday?
Yesterday was the worst day of my life.
Okay, tell me about it. The people who don't understand that, because I tell all my patients, right after the surgery, you cannot not feel all that screws I put in.
I was screaming, please help me, please help me. I really thought I would pass out. Candy told me today.
Right after the surgery.
Yeah, well, yeah, when I came to, Candy told me today that they were trying to help me, but I didn't even know people were helping me. I was so out of it.
Yeah.
And I was in horrible pain. Then eventually they gave me diet.
We have lots of different medication.
Yeah.
You got a cocktail of medication. So we are prepared to help people, but sometimes it takes time for all that medication
And then
to kick in.
Candy says about 6:30 in the morning, I started to get better. And I've been feeling really pretty damn good today.
So, and that's what I tell all my patients, and and I cannot overemphasize, and it's better they hear it from you. You cannot have all this hardware, all this metal in you and not feel that. Your body thinks, what is this? I don't know what it is.
Yeah.
I'm going to
Reject
tell you something that this is something not right here, but then it noticed that it's really not causing any harm. And another thing is, in a traditional surgery, actually where we cook the tissue, we take the ability, that's what we do in a traditional surgery. We cut because bleeding and we cook the tissue, and that sort of take the sensation away. So initially, sometimes after my surgery, people are in more pain than traditional surgery right the first day, because I can compare it to the 1st degree and 4th degree burn. 1st degree burn is when tissue is not really super damaged, so you feel all the nerves are shooting signal. 4th degree burn is like all your skin is burned.
Your nerves are destroyed.
The nerves are destroyed. You don't even feel the pain, but you won't recover from it.
No, right. I know a person who died that way.
Yeah.
It's horrible.
And so my surgery is like 1st degree burn, because I keep all the tissue pristine. So if you're not don't manage it with the medication and so on, sometimes it can be painful.
That was very
And
painful.
unfortunately, you are one of those patients. Not everybody gets that, but we tell everybody it can be very painful at first.
Well, let me say this.
Yeah.
I could have gotten traditional surgery in August or early September, and I am so glad I waited, because I investigated and I found out about the difference between the traditional surgery and your surgery, and I am so happy I waited.
Oh, thank you. Now, we have the data on that. Like, we know that the risk of your surgery having an infection, and those infections can be deadly, is 1/30th of open surgery.
Wow.
We know that recovery is 2, 3, 4 times faster.
Yeah.
We know the blood loss is 1/10. And as a matter of fact, we lost 82 cc of blood in your surgery. 82 cc is like 1/4 of a cup of
Oh
coffee.
my.
So it's really barely.
It's nothing. It's like a bad cut.
Yeah, it is like
Yeah.
a bad cut, and all of that turns up into faster recovery.
Yeah.
But I want you to emphasize again how bad the pain was yesterday, because some people will be like that, and it's at that moment, it doesn't matter how often I tell patients it's going to get better.
It was the worst 6 hours of my life, but I am so grateful today I went through it. That's all I can say.
Now, after traditional surgery, that pain just continues. It doesn't stop next day. That's the difference. That's sometimes the difference, okay?
Yes.
Well,
it's
thank you
wonderful.
for the interview. I really appreciate it. It's important for my patient to see the other side of the coin as well.
Okay.
That can be rough at first, okay?
All right.
Thank you.
Oh, thank you, sir.
You're welcome. You're welcome. Thank you.